Let's get into some of our featured herbs in this section. So, as we've been doing, we're going to take a look at the pictures of the herbs. We're going to talk about them a little bit as herbs on their own, but obviously within the context of, in this case, female endocrine patterns, in this case, excess patterns. First one here is indeed black cohosh, Actia racemosa. This is a good herb. Also called Semicifuga racemosa. I never remember which one's the new name and which one's the old name, but they are indeed the same herb. You'll definitely see them. This is our black cohosh. I don't know if there's too much to say about it. It will grow around here. It's not as abundant as its counterpart, its big brother, blue cohosh, which we'll see next, but you will definitely still see this one around here. That's what it looks like. Let's look at our monograph for it. It is an emmenagogue, so I mentioned in the last video it's kind of like blue cohosh junior. Yep, it does help things move. I don't think it's nearly as strong as blue cohosh, but it does seem to do that job. Unlike blue cohosh, which really only does one job. Black cohosh we use as many other things, and in fact, anti-inflammatory. I think it's actually reasonably good. I think it's underrated as an anti-inflammatory. And I think, yeah, there it is. We actually use it also for vertigo and to some degree tinnitus. And I do find it's actually quite useful in these. In fact, you've probably seen me do this before, but I often pair it with, for vertigo and tinnitus, we often pair it with ginkgo plus hydrastis. And then, of course, plus our black cohosh. This is a pretty good formula. I use this quite often specifically for vertigo. And I like it, and it does seem to work pretty well. I find it's only okay for tinnitus, but that is another use. Obviously, that's not the use we're talking about right now, though. So let's see if there's anything else we want to say about it in regards to treating female hormone patterns. Not really. It's generally considered safe, not recommended during pregnancy except to stimulate labor. Sure, that's going to be even more true of our blue cohosh. It is really just broadly used. Almost every female condition, you'll see black cohosh show up, and that's probably fine. Oh yeah, this is another one. Actually, I'm glad this is in here because I had forgotten this. It's also thought of as a specific during menopause to help with, particularly with hot flashes, and I find it works pretty well. I will often use our black cohosh plus some Romagna. I find this works quite well. Should be two ends there, and I'll often use a little bit of sage as well. That's a reasonably nice, pretty strong combo for hot flashes and for menopause, which largely is amenable to treatment. We haven't really talked much about that. We will mention menopause in our deficiency pattern, because obviously it is a state of deficiency, though of course a natural one. So we'll talk about that a little bit further, but that's a good combo that I actually like. Black cohosh and Romagna. You could even put some of the Dioscorea in there. I find it works all right there. Not so much in hormones, but more in that it's a kind of a yin rooting herb. Okay, pairs well with Vitex, sure, if we got into some of those other things. And then, of course, blue cohosh, particularly in labor-stimulating formulas. Let's look at blue cohosh next. Let's go over and take a picture, take a look at the picture of it, because it's nice to see, I think it's nice to see the herb before we talk about it. You get a little bit of a visual image there. This is blue cohosh. This one, all of these are pretty good pictures. This one is very abundant here in southern Ontario. It comes up early, and I don't know if I'll be able to find a picture here, but the early leaves, there you go. Oh, I guess that's the flower. It makes kind of a bluish purple, but the early leaves also look this color when they come up. It comes up early in the spring. That's what it looks like. Oh yeah. So look how different that is. Well, that's good. I don't know what those berries are, but look how different that is. That's it sort of in its mature form. This is it when it comes up early in the spring. And pull that one up there. Oh boy. Okay, well that's its regular form. Where did our other one go? There it is. So that, it's kind of crazy. It looks like it's not even the same plant, but that's what, I don't know what cohosh means, but you kind of get that idea. It has a bluish tint when it first comes up in the spring, and then it has a very characteristic leaf pattern that, I don't know about those flowers, but the leaf does have this kind of tri-lobed, sort of somewhat pointed leaf. That's a pretty good looking leaf there. That's our blue cohosh. It's the root that we use, and it's strong. It's strong enough that you wouldn't accidentally eat this root. I tried even just chewing a piece once, which I do often with a lot of herbs. Sometimes I get teased at my clinics. I'm always chewing on an herb. And yet, blue cohosh would not be one you would chew. I tried once and I was like, whoa, no, this is not good. I don't think I'm supposed to eat this. It's quite scratchy to the throat. It's not toxic. Well, that's not actually entirely true. It is a little toxic if you have a lot of it, but it's mostly just kind of diarrhea and stomach cramps. I don't know about this chest pain. It's possible because of its effect on smooth muscle. But if you eat too much of it, if you consume too much of it, you'll get diarrhea because it's a laxative, smooth muscle stimulant. So parturient, yeah, that's one of the main places we use to encourage labor or menagogue in general. It's also a laxative. Alkaloids, contains alkaloids. I don't know what's stronger, the alkaloids or the saponins. I think it's the alkaloids, but I'm actually not particularly sure. I definitely use it in fibroids and PCOS and endometriosis. This is a staple herb in these conditions. Okay, yeah, don't ever do this, but this is used as our #1 abortifacient. You'd have to be lost in the woods and have some really wild explanation as to why that was a good idea. Otherwise, botanicals, maybe this is a good place to put this bit. You know, always feel a little not self-conscious, but aware that people are listening when you say things like this. In my opinion, I think it's a pretty solid one. Never attempt to terminate a pregnancy with herbs. It's not safe. And if you're thinking to yourself, yeah, I wouldn't do that, I believe you, that's great. But you will get the request. I've had that request 3 times. And even once very aggressively where a woman said, I'm going to do this. I need you to tell me how safe that is. And my answer was, it's not safe. And yet I'm confident she walked out of there planning to attempt to terminate a pregnancy using herbs. Can it be done? Sure, probably. But what's the likelihood of success? Nothing compared to what would happen if a woman were to do an actual abortion. What's the safety profile? Way less than an actual medical abortion. Lots of people have personal opinions on abortion. That's not my concern in this video. My personal opinion on using botanicals for an abortion is that it shouldn't be done. It's a bad idea. And that's not me taking any kind of like moral stance or like, oh, the board says we have to say that. It's a personal opinion. Those are both, well, for second part in terms of the board, true, but I would strongly discourage ever trying that. You'd probably lose your license for it as well. Hopefully that's enough to dissuade you. However, it probably would get the job done because it is a strong stimulant to the uterus. I think this is important to point out. It's generally reserved until active labor has begun in order to enhance the contractions or strengthen the contractions, particularly during prolonged labor in which the woman's vitality is waning. I think that's important. It gets used, I think, too soon and too often to try to stimulate a pregnancy. You can do it that way as well. You can say, okay, you're due to be induced in a couple of days. Let's try using some strong herbs, see if that gets contractions started. I would strongly discourage saying, okay, start now and just keep using this until contractions start. I don't think that's a good idea. I think the best place for it is what we've got here on our screen, which is to say, once labor is started, if contractions are feeble, then you can use it to strengthen those. You can always use it to strengthen contractions. It's probably best used at a later time in labor. Often, this is, I guess, a little better way of using it. Can be used as well, although again, medically would be a better way to do it. Expel retained products of conception. It is teratogenic, so you don't use if a patient is trying to conceive. Yeah, don't do that. I don't know. I've seen it. It does list as teratogenic. I don't know if that's actually true. That might be people just trying to scare other people. But you definitely do not use this herb in pregnancy or even in pre-pregnancy. However, you will see it listed in some old books as a uterine tonic, which is not a word we've probably encountered very often. And I remember the first time I heard it, I actually paused. I was like, wait a second. Traditional use of blue cohosh as a uterine tonic is to prevent recurrent miscarriages. And yet we say it's a strong uterine tonic to prevent, I don't know about conception, but to encourage the uterus expelling products. So what's going on here? And the idea is in large doses, it's such a strong stimulant that it should expel things. In less strong doses, it should be this is kind of the best way I've heard it described. I don't know if the terms are exactly accurate, but to a A flaccid uterus. That's a weird couple of words to be saying together, but a flaccid uterus adding tone helps it hold a pregnancy. And that's the idea, and that's why you will see in some places recurrent miscarriages, threatened miscarriage, the idea of toning, using the right dose, toning the uterus to maintain that pregnancy, as compared to how we often use it to actually, primarily, I mean, I've been talking too much about fertility because really where we use it the most is as an emmenagogue. So that's where, like clinically, that's where we use it most often in treating non-pregnant patterns of fibroids, PCOS, or endometriosis. It's a great herb to use there. Okay, hopefully that's all we need to say about blue cohosh. Let's take a look at a much more gentle herb. This is Michella repens, partridge berry. Looks like this, definitely grows around here. Have I seen it in the wild? I think I have, but I'm not familiar. There are quite a few things that look like this, and that berry doesn't look quite familiar enough to me to say, oh yeah, I've seen that for sure. Here's our partridge berry, Michella repens. We usually just call it partridge berry. It had a old name that we just don't use anymore because it's very culturally offensive, but it was suggestive that this is actually an indigenous herb that was used by a lot of the First Nations here in Canada, I think in the US as well. And as its former name suggested, it was actually considered a woman's herb. And it's probably our best, this is my opinion I think, but probably our best all-purpose female herb. This is one of the few, other handful, that I use in both deficiency and excess patterns. It does seem to be a bit of a parturient and a emmenagogue, but it's also an astringent, far more mild than, certainly than blue cohosh, I would say even than black cohosh. It does have alkaloids in it, so you want to be maybe careful, but there's no reported toxicity, and it's been used safely in pregnancy in Native American traditions for many generations. So I actually feel very, although we don't know that much about this herb, we don't know that much about its constituents, etc., I'm very comfortable with this one. If a woman has been taking this for whatever reason and then she says, surprise, I'm pregnant, which happens, by the way, like that's sometimes it shows up on exam questions like, okay, and now your patient's called you back and she's just found out she's pregnant. What should she do? Should she worry about the formula she was on? Most of the time the answer is no, but it does happen. In fact, it happened 2 weeks ago when a patient was taking herbs that I prescribed for something else, and then did send me a message saying, hey, what if I'm pregnant? Can I still take those herbs? And it's sort of like, are we talking theoretically or are we talking actually? But the answer always is, stop the herbs. We'll meet again. We'll reevaluate. But the answer also is, don't freak out. If there's blue cohosh in there, same thing. Be less likely to conceive if a woman was taking blue cohosh, unless maybe the uterus did need that toning. But it's just a matter of saying, yep, just stop. We'll go from there. There's not much you can do anyway. It's too late at that point. So Michella, it's a herb. I don't think I ever lead with this as a herb, but very commonly it's going to be hanging out with black and blue cohosh in just about every formula. But probably I use it a little bit more in the excess formulas, though I think we'll actually even still see it in our deficiency formula. So that's our partridge berry, Michella repens. Let's look now. This one we've talked about quite a bit. This is peony. And these are, I think, mostly decorative because they mostly look pink. That's probably our classic peony right there. That's a nice picture. So that's white peony by Xiao, Paeonia lactiflora. There are many other types of peonies. They're probably somewhat interchangeable, but for the most part, stick with the lactiflora. Often this is called Paeonia alba, just to say that it's white peony. So if you see Paeonia alba, it's almost definitely Paeonia lactiflora. That's what it looks like. You've probably seen it before. It definitely grows as an ornamental. It's a nice flower. It gets so heavy it often falls over, which is part of how it produces its seeds. I always thought to myself, what a not smart flower, growing tall and then just falling over. How does it not see that coming every generation? And I realized, oh, that's part of how it spreads its seed. It goes up, and it starts to droop over, and the seed falls, and it either disperses in the wind, or where it actually falls, it puts its seed into that ground, and that's where we get, sort of stands of similar flowers, because the seed is locally dispersed. All right, that's our Paeonia, and again, depending on which tradition you're using, by Xiao, same herb in TCM. And there it is right there by Xiao. Very popular, far more popular in TCM than it is in Western herbal medicine, though I would suggest it's really gaining some traction. It hasn't taken off like I thought it was going to, though. There were probably about 4 years ago I was saying, oh yeah, this is going to be the year for peony. Buy stocks in peony. It's going to take off this year. Never really did, which is probably unfortunate because I think it's actually quite an effective herb. It's probably a true female endocrine modulator, bit of an alternative. I don't know about antispasmodic. Mild adaptogen, I think it's more like some of the outcomes give some adaptogenic feel to it, but I think it's mostly because it does a little more of this stuff. And it's actually not a bad, it's actually, in TCM, it's used as a hepatic. But I've also heard this said, and I kind of like it, it's like a warm hug for your liver. So that's nice. I don't know who doesn't want one of those, but often in a lot of these patterns, and when I say warm, I don't actually mean heating warm. I mean, like, let's say even like gentle or soft. It's not compared to some of the other herbs that we've seen in this section that we won't necessarily review here, but some of the ones like Rheum pomatum, which is really quite strong. That's almost like a squeeze to your liver, like squeeze it all out. And then sometimes gentian is almost like a punch to the liver. It's pretty fast, like, okay, get to work. By shower, white peony is more like, okay, it's all right, liver, you can do your job. Let's just soften you up. Come on in. Everything's going to be okay. But it does still do that. It helps build blood and move blood and improve the function of the liver. So you'll see this at least in TCM, you'll see this in pretty much every women's formula. Certainly any of the ones where we want to improve the function of the liver. Okay, generally considered safe. Yep. I don't think you have to really worry about interaction with anticoagulants. Not really established, but this is definitely not a herb that I worry about. This one is quite nice. We never know. We could find out tomorrow that it's not, but even when you taste this one, like, oh, this probably does something as a medicine, but it doesn't feel like it's toxic. You could probably eat it, but I don't think it'd be very... I personally find the taste of it gross, but that could be for a number of reasons. Okay, let's see. Not too much to say about it there. Okay, let's look at another herb then. Let's go to... I have to move this. Oh no. Here we go. Viburnum. We're going to look at two viburnums. We've got Viburnum opulus, which is cramp bark, and then we've got Viburnum prunifolium. You can look at them and be like, well, those don't really look very much the same at all. How do those get to be the same first name? I don't know the answer to that. They do have some things in common. That's actually, this is the flower. It's a pretty flower. I haven't seen it too much in berry, or maybe I just don't recognize it because so many trees make that type of berry. But this is cramp bark. This is what you will usually see in terms of what you will get. And you can chew it. It's fairly astringent. I wouldn't chew it. It's probably not the best way to take it. Usually tincture is the best way to take it. You can make a strong tea out of it as well. As the name implies with a herb like cramp bark, what do you think it does? Antispasmodic. Probably one of our best antispasmodics. In fact, so often thought specific to menstrual cramping that we actually forget, there are other times when we want to use an antispasmodic as well. Something like kidney stones, gallstones, those would be a fine place to use cramp bark. So don't only think of it as a herb used for menstrual cramping. Let's see what else we want to say. It does have some catechin and epicatechin, and these are found in green tea as well. And I don't know how much of it we actually find in there, but it's interesting. It is going to contain tannins for sure. It's going to be astringent, which means it's a little bit antimicrobial, but we don't really think of this as an antimicrobial. Often also used in threatened miscarriage. Same idea. So it's to stop spasms of the uterus. It's to provide some tone to the uterus. Let's see. Not much else really to say about it. We talked above about how it's often paired with Pisidia and maybe our Cali Poppy, Ischscholzia. It's just a fun word to say once you can get around it, as a specific combo for cramps. So we took a quick look at our Viburnum opulus. Let's take a look at our Viburnum prunifolium. This is called Black Haw. I think this one's actually underrated. I think this is a good herb, and I think of this very similarly to Michela. This one fits an antispasmodic for sure, but it seems to also do a few other things that I think are worth including. And I also think of this as a kind of an all-purpose herb where it's generally safe, useful cramping, threatened miscarriages, uterine congestion. This is an interesting concept. We'll see this more when we get into BPH. Used similarly to the Viburnum opulus and often used very well together in combo. Yep, I agree with that. I mean, I wrote these notes, but I agree with that. Less acute than cramp bark and greater properties as a nervine. And that's probably worth considering because we almost always go like, oh yeah, cramp bark, let's use cramp bark. Okay, you got cramps, we're going to use some cramp bark. There are probably some other things that may be worth looking into, and don't forget about Viburnum prunifolium, our black haw. Hypertension, I haven't really used it there, but it certainly could be used. That would be fine. Okay, let's look at the star of the show. We probably should have looked at this one first. Because Vitex, you can always tell how popular something is when there's a whole host, a whole row of supplements that come before, because they're more popular, come before looking at the herb, or in this case, it's kind of like a shrub tree. We do have one of these in our CCNM garden. It looks a lot like this. It's not the actual one, but it looks a lot like this. Let's see if we can pull up a picture here. I want to try and get, that's too close. I want to, we just see it in flower. There are the berries. Yeah, let's look at this first. Because that's actually what you're going to get. The tree is pretty. That's a nice tree. But this is what you get, and these are the berries. You can see how they kind of look like little peppercorns. So, you know, they get the name monk's pepper because they actually look like peppercorns, but they, boy, that I would not pay that much money for them. That's too much. Hand-picked from the wild mountains. I wonder what's wild about them in Turkey. Laser sorted. Wow. That has got to be some amazing Vitex. Laser sorted. I confess I have never sorted my Vitex with a laser. Okay, that's our Vitex. So that's what it usually looks like. In terms of the berry, that's the tree there. It's a nice tree. And if you want to get to know it, you can go see the one out in our CCNM garden. But I've never seen the one in our garden make berries. I don't know if it has the pollinators here, or maybe it needs another tree. It can't self-pollinate. I don't know the answer to that. But the one in our garden will make flowers, but I've never seen it go to the berries. I'd like to actually try some fresh berries. I wouldn't have too many of them, but I think that would be kind of cool to try. I don't think it natively grows here in fact, no, it's not true. I know it doesn't natively grow here in Southern Ontario, but obviously it can grow here. This one is a true female endocrine modulator. Androgen normalizer? I'm gonna change that. Androgen, I think it's important to say androgen suppressor. I think we almost have to say that at this point. It's a galacticog as well, sure it is. The iridoid glycosides may be the main active ingredient here, constituent. I'm not sure. Diterpenes. This, actually, you know what? I might have to take that back. Iridoid glycosides are probably an active constituent, but the diterpenes, which are a lot of what gives it its aromatic, are also going to be quite, I believe, quite active from what we know. We know a fair bit about Vitex. But I feel like Vitex is a herb you have to check in on it probably once a year, just to be like, hey, did we learn anything new? So far, what we're pretty sure, and I'm careful with stuff like this, is that it is actually at the level of the pituitary, and it is progesterone-mediated pathways. I think, yeah, so research, at least the last I checked, was not conclusive. It is thought to act as an amphoteric to progesterone and prolactin. I've also read, though, that it is progesterogenic. Keep that in mind. I'm not positive on that one, but keep that in mind. And like we said above, it is probably anti-androgenic. I would suggest I see these actions. You know, if I were to guess what it does through what I see it do clinically, I would suggest that these actions do seem like they do both occur, but we don't know. We do know it has a hormone effect, for sure, but I don't know much more. I'm not sure anyone knows a lot more about it in terms of that. Interesting, probably research to come. Okay, that concludes our look at the herbs, the featured herbs in this section. These are some herbs you will see often, like we've talked about. You're going to use these herbs quite often. Vitex is one of the most commonly used herbs by NDs. I think overused. I think start with some hepatics and certainly some alternatives and progress as needed. But hopefully this has given you at least a primer, an introduction, and maybe some knowledge about some of the herbs that we are going to see and that you'll see commonly in clinic. Okay, see you in the next set of videos.